Over the weekend, it was World AIDS Day. It's on December the 1st every year. And this morning, we are very, very happy to have with us Ahmed Khamis, who is joining us from the UNAIDS.
Yeah, Ahmed Khamis.
Sorry, I didn't get the kha in there. Ahmed Khamis.
Yeah, the UNAIDS Country Manager. Good morning, Ahmed.
Good morning, Sally and Mark.
Good morning.
Good morning to you. Now, tell us about UNAIDS. Tell us about World AIDS Day of the weekend.
Well, on Friday, it was the 1st of December, which is the day where the world commemorates World AIDS Day. And we also celebrate it here in Egypt. We've had a few activities lined up, starting with a run for young people with Cairo runners on 1st of December, which was really great. The turnout was very, very positive. Mm-hmm. We've had over 2,000 people maybe participating.
2,000 people want to get up at 7 o'clock on a Friday morning?
I was surprised as well. I mean, that's impressive.
That's
on
great.
A long weekend.
On a long weekend, exactly.
We're very lucky to have people who are very much interested in the cause and definitely in the run. Mm-hmm. And we've managed to speak to a lot of people who are very much interested into spreading the word as well, because we are really in desperate need now at this time to really communicate positive messages, not just to address the issue of stigma and discrimination related to HIV, which is the main theme of the campaign, but also to spread information about how it's transmitted and how can we prevent it from spreading further.
Well, also, I mean, here in Egypt, people would think, well, there is no AIDS in Egypt. What's the point? What is the truth of the matter?
Yeah, what's the reality?
Yeah, HIV and AIDS. Is it here in Egypt?
Yes, it is, and it has been for many, many years. But it has been increasing in the past few years, actually. And the rising trend, we're seeing a rising trend in new identified cases by 25% annually for the past 3 years. So it is on the rise in Egypt. It is important that we know more about it and know how to protect ourselves.
Mm-hmm.
Okay, and so I mean, you say the message of this campaign is to sort of remove any stigma around HIV. So how do you go about that? And I mean, what is stigma for anyone listening who doesn't really understand what the word stigma means?
Very good question. Well, when we're talking about stigma, we're talking about the internal feeling that one would have that is quite negative towards a person based on an understanding or misunderstanding of the issue, based on prejudice about the issue. Then if the person applies this stigma in the while connecting with people, then it is discrimination. So we're always talking about stigma and discrimination. How we are tackling stigma is pretty much by spreading the right information, correcting misconceptions, and that's why the theme of the campaign in Arabic is "A'raf ifham ma tawsamsh," which means you need to know more, understand more, and then not to stigmatize eventually, which is hopefully the process that we are going through now.
When the disease came about in the 80s, when people first started knowing about it, it came out in the press were going mad, and it came out in all the wrong way. And ever since then, people have been dealing with that kind of discrimination and the way that people feel about HIV and AIDS.
Also the wrong information.
The wrong information, fear, misconceptions
people
about it.
People thinking you can receive it by giving someone a handshake and all those things, which obviously is not true.
Yeah.
I mean, we have been working hard for the past maybe over 10 years to correct what happened late 80s, maybe early 90s as well, especially in Egypt. A lot of media interventions were not really positive about it, and there was not much information, and it was perceived as the deadly disease. However, it's not. It is a chronic disease. People living with HIV are living healthy lives normally, just taking the medications daily, just like any chronic disease like diabetes, hypertension. We don't have a cure for it, but you can live with it positively for many years and not have or suffer any health problems.
And that's what I mean. People with diabetes, no one looks down on a person with diabetes. You know what I mean? And the way that people look at people with HIV. It's a strange thing, isn't it? We're going to come back and we're going to talk some more about this with Ahmed Khamis here this morning from UNAIDS. This Sunday morning, we're here with Ahmed Khamis from UNAIDS after World AIDS Day, and they've got so much going on in December, have you not?
Yes, indeed.
Yeah, you have. I'm going to come on to some of those events shortly.
Yeah, but first, I just, for anyone listening who thinks, maybe AIDS or HIV is not really a big deal, or it's a very small problem here in the region or in Egypt. Can you give us some actual statistics, actual figures to give us an idea of what we're dealing with?
Definitely. Where in the region we have an estimated 230,000 people living with HIV.
Wow, that's a big number.
That's in the Middle East and North Africa, yes.
Right, okay.
In Egypt, we have an estimate of 11,000 people living with HIV, but it's growing, unfortunately. And, I mean, we do not really judge the size of the problem by the number of actual or estimated people living with HIV only, but also look at the trend. And the trend in Egypt is quite alarming. And this is why it's very important that we put back the spotlight on the issue of HIV, put back the spotlight and investments on prevention specifically, because we do not want more people to get HIV.
No, and of course, you look at a number like 11,000, and it might seem relatively small in a population of 80 or 90 million, but that number will grow very quickly if people just sweep it under the carpet and they don't
talk about it
or address or even think about the problem.
Exactly, and that's what we're trying to prevent from happening. We do not want it to turn into a bigger problem that is too expensive to deal with.
Right.
But we want to really address it now while it's still under control in a way.
Well, this is what you said earlier. You said it had grown by 25%. Now, that's a huge margin of growth. Oh, excuse me.
Yeah, I mean, what is the care like for someone living with HIV in Egypt?
Well, they can get in touch, of course, with the government-provided treatment program, which is for free. They can get the care through the government hospitals. So we have that covered in a way, but we need to encourage more people to get tested and know their HIV status, because the earlier that they get to know their status, the earlier they can start treatment and live a healthy lifestyle for life. They don't need to worry about reaching the final
It's not a
stage.
death sentence anymore.
Not anymore. It's a chronic disease.
So this is the thing, right? So in order for people to go get tested, in order for people to speak about it, for people to seek information, to educate both themselves and the people around them, we have to remove this idea that AIDS is not something that will ever affect us, or if it does, then there is that idea of there's a discrimination around it, like you said. So how have UNAIDS, have you been working to remove this stigma, shall we call it?
Well, this year's campaign, I mean, we've been working for years, of course. Around World AIDS Day, we have national advocacy campaigns and awareness in universities with medical students specifically and other students in universities, working with civil society organizations at the community level who are spreading the word across Egypt in different governorates.
You have a cough. It's fine.
You can have a cough. I had a
Don't
cough
worry.
5 seconds ago.
No worries. We also have a lot of campaign activities lined up. We have an upcoming one actually. Beside the sports event that we had on the 1st of December, we have another event on the 15th of December with Fit Squad. Please join if you're listening to this. It's going to be targeting also spreading awareness and addressing stigma and discrimination. We also want more people to be engaged with the university campaigns and with our social media portals if possible. We have a Facebook group. It's WAC Egypt, WAC space Egypt.
And he pops up.
Yes.
It's there.
And it has all the updates about the campaign, and a lot of people may also volunteer or just help spread the word.
One of the things that you said, just a second ago we were talking, and you said that of the women who have HIV in Egypt, 90% of them got it from their husbands. So you never quite know, do you, in that situation, if you've got a bad husband or whatever. I mean, these people, no one deserves a stigma towards HIV and AIDS either, but I mean, you've got to look at, and babies have it as well,
Because you can give it to your child.
Give it to your child, and lots of children live with HIV. So it's really time to take that stigma away and treat AIDS in a different way, right?
Yes, this is the time really to look at it differently, and this is the time to address it and look at it as an issue that affects all. It's not just limited to a group of people, and it's not just limited to people outside of the country. We are talking about Egyptians who live with HIV daily for years now and are who contracted it and could be also passing it on to others. And we really need to know how it's transmitted, and we need to know how we can protect ourselves. And we need to also make sure that when we are learning about it, that we do not really stigmatize or treat people who live with HIV negatively based on misunderstandings or misconceptions about how it's transmitted. Shaking someone's hands, working with somebody, sitting beside somebody, living with somebody who is living with HIV, the normal living does not really transmit the virus.
No, and you know, no one looks at a person with cancer and recoils from shaking their hand like they do with people with HIV.
Yes, exactly. And it's partially because people really judge some of the behaviors that may transmit HIV. But as you've said, for example, 90% of women living with HIV or a bit more have got it through their husbands within marriage. So it really does not make sense.
And needless to say, children, of course, who get it through, whatever. It's, there's a million ways for it to be transmitted.
People, you can judge the activity that might have caused it, but you don't judge someone when they have a disease. And I know you've been working with religious leaders, haven't you, as well? We're sending out a really positive message.
Yes, very actually positive. We've been working with Habib Ali al-Jafri and also figures from the Coptic Church. They've been very positive about accepting, embracing and helping people living with HIV because they have a disease, and we need to really help to support them, and that you don't necessarily need to approve of the behavior, whatever it was, but you can still accept, tolerate and love and support people living with HIV.
It's all about compassion, isn't it, at the end of the day?
And that's what religion teaches, no matter what religion you have. That's what it teaches, to be more compassionate and to love your fellow brother or sister or whatever.
Exactly.
And that's what we need. Okay, well, we're going to come back, and there's a few more things we need to talk about. It was World AIDS Day over the weekend. It's December 1st every year, and we are joined by Ahmed from UNAIDS. You are the UNAIDS
Country Manager.
Country Manager.
Yes.
You manage Egypt.
Yes.
Yeah, well done you.
Well, okay, so we've been talking a lot about HIV and AIDS and that sort of thing. I think a lot of people say that or think that HIV and AIDS are the same thing. There's a distinction. Is that correct?
Yes, it is. And I'm happy that we've raised that, because a person living with HIV who contracted the virus does not have any symptoms. A person can live with HIV for many, many years, as long as 10 years, without showing any symptoms. Completely normal, living a normal life.
So you wouldn't have any idea that you were
contracted HIV. Of course, no. The AIDS basically is the final stage of infection. When the virus has been in the person's body for a long time, then it starts affecting the immunity, and then other symptoms may show for other infections that we call opportunistic infections, who took the opportunity that the person's immunity is very low and start hitting the body. So not everybody living with HIV would reach the AIDS stage that we have this, let's say, image or mental image of. A person living with HIV looks like anybody walking in the street. And if a person living with HIV knows their HIV status and start the treatment and goes on it regularly, which is, by the way, provided for free by the Ministry of Health, then they can definitely live for as long as they wish, totally healthy, normal, no problems there.
But the problem is recognizing that there is a problem and people being tested for this and stuff like that. And I know that you're telling us that for women, it's obviously more difficult.
Very difficult in the society for women to get access to information.
Exactly. A recent study we've done shows that much less women know about HIV, how it's transmitted and how it's prevented, how to protect themselves, which is really a big problem because that makes them more vulnerable to HIV. They cannot really access the information as much as men in the same age group can, which is quite problematic. And not that only, but they only cannot access services like prevention services and testing services.
So what can we do?
Well, where can people get information? Where can women go to online or whatever to get information?
Well, online we do have a Facebook page that would love to welcome any inquiries, and then we can basically push people to know more, whatever they can get the knowledge in person if they wish.
And also, no one's going to judge. No one from your place are going to judge anybody just for asking for information. They're not going to think, oh, what have you done? Well, nothing like that. It's completely stigma-free.
Of course, and that is definitely the case. I also want to ask people maybe to also check the hotline. There is an AIDS hotline there. It is provided by the Ministry of Health, regular working hours. It's 0800 700 8000, and people can just call that hotline or just get in touch through Facebook and we can direct them there. It's WAC Egypt, WAC space Egypt, and we're happy to push things also and to give you more knowledge, information, and direct you in the right way.
Perfect.
Yeah, I mean that's really what it is, because people need to know. That's what you need for anything to be like an epidemic like this or a potential epidemic. For something to be put under control, you have to know what it is, where to go, and then how to deal with it if you are infected or if you know someone who is infected with the disease.
Yes, and the test is completely anonymous, by the way. There is a complete confidentiality. There is a pre-test and post-test counseling to make sure that the person is ready to and understands what HIV is and what could give them HIV.
So to reassure them more than anything, isn't it? Because it used to be seen as like a death sentence back in the day when it was in the 80s and 90s. I guess people panic, but it's like having any other disease, and it's a long-term disease.
It is. And also the good thing about treatment, that if a person knows that they're HIV positive and they start treatment, in 6 months, the virus inside their body will be too low that they cannot even infect others. So in a way, it's also a prevention for others.
Sort of.
Exactly.
Right.
So we're really happy with what treatment is doing now and with the advances in that, and that it's already available by the Ministry of Health for free for everyone who needs it. So
That's so good.
Yeah,
That's
it's
amazing.
really good.
So anyone listening, if they've just tuned in, if you want them to take one thing away, what is like a message you want to drive home right now about AIDS, HIV, and of course about the awareness?
HIV and AIDS are not the same thing. A person living with HIV can have a very long and healthy life on treatment, but they need to know their status. So do get tested, and treatment is provided for free by the government. And please, please, please do not stigmatize people living with HIV. They need our compassion and our tolerance, and not anything negative.
Nothing less than that.
That's
I think
great.
That's
The
beautiful.
bullet points in a nutshell right there. Hello to John Naim, who says, as a doctor, I would like to participate in the AIDS campaign. How can I, says John?
Please do get in touch through Facebook, and would love to have you on board.
Awesome, lovely, excellent. Well, it's been really nice to talk to you, and I hope lots of people listening right now have learned something and have taken something away.
And take the time to like the Facebook page and
Yes.
see how they can get involved in events and help spread the awareness themselves, because it starts with everyone taking it on and spreading the word.
Thank you very much. It's a pleasure to be here, and I would like to especially thank Nile and NileFM for their massive support to this campaign.
You don't have to thank NileFM. Thank NileFM. That's only leave them next door. I'm kidding.
No, thank you very much, Ahmed Khamis, the UN Country Manager.
UNAIDS.
UNAIDS Country Manager.
There we are.
Yes, there it is.
Okay, thank you very much.
Very nice to have you. Take care.
You too.
Thank you.
brother.